Hi everyone, I am Beatrice. In today's video, we'll look at folate deficiency anemia. So we'll be looking at the pathophysiology / causes, the signs and symptoms, some complications that may arise from this deficiency, how to diagnose it, and the management, including nursing intervention, patient education. And before the end of this video, as usual, we'll look at some NCLEX-style questions that will test your knowledge of folate deficiency. So if you're ready for today's video, let's dive in. In my previous videos on anemia, like iron deficiency anemia, pernicious anemia, we were able to establish that anemia has to do with a decrease in circulating red blood cells. To be precise, circulating healthy red blood cells. And we know that red blood cells carry hemoglobin, and hemoglobin is the oxygen carrying capacity of the blood. So when there's a decrease in circulating red blood cells, that means there's a decrease in hemoglobin, and that also means there's a decrease in oxygen availability in the body, in the cells, in the tissues. And the patient is going to manifest those symptoms that are unique to anemia, like pallor, fatigue, dizziness, tachycardia, increased respiratory rate, and all those things that have to do with decrease in oxygen circulating in the bodies, in the cells, in the tissues. For folate deficiency anemia, it is also called folic acid deficiency anemia or vitamin B9 deficiency anemia. Now, folate is gotten entirely from food sources. Our body does not produce this, just like for vitamin B12. We get it especially from plant sources, so high in plant sources like green leafy vegetables, legumes, anything that has to do with plant sources, nuts, seed, and we get it also from fortified cereals. We take in this folate as polyglutamate, which is converted to monoglutamate by an intestinal enzyme known as conjugates. When it is taken, it is absorbed in the small intestine, particularly in the jejunum, and then finally is stored in the liver. Another thing you need to know about folate is that it's needed for RNA and DNA synthesis. So when there is decrease or deficiency in folate, that means there's going to be impairment in RNA and DNA synthesis. And that's why the red blood cell, when it is produced, is usually macrocytic. That means it's going to be larger than normal, greater than 100 femtoliters. And it will be megaloblastic. So the red blood cells are released immaturely. They are large and released quickly into the bloodstream because of that impairment in DNA synthesis. So proper division will not occur. It continues to increase the size, but it doesn't divide properly. Another important thing I want you to know about folate is that it's needed for neural tube development. Very, very important. In fact, you need to know this. If for exam or anything, you need to know this about folate. So if a woman is of a childbearing age, is planning to conceive, before you conceive, you should start taking folate. You should take at least 400 micrograms per day because this folate is very, very important for neural tube development. So if there's a deficiency in folate and you are pregnant, you are at risk of neural tube defect, like the spinal bifida, anencephaly, and all that. Now let's look at the causes of folate deficiency. A major cause is alcoholism, because normally we get a lot of folate from our diet. We get it from food, we get it from fortified cereals, we get it from plant sources, even from some animal sources. But when somebody is a chronic alcoholic, it can result to folate deficiency because alcohol inhibits absorption of folate. Then another thing is damaged intestinal epithelium. Any of those diseases that affect intestinal epithelium, that destroy those epithelial cells of the intestine, that will now affect absorption, it can result to folate deficiency, like all those inflammatory bowel disease, particularly Crohn's disease, also in celiac disease, and any gastric surgery like gastric bypass surgery, it can result in that absorption issues. Then increased tissue demand, like in pregnancy, a pregnant woman will need more folate than others. So at times they may even prescribe more than 400 micrograms up to 800 micrograms per day, depending on the need. So it's very important because of that increased demand by the fetus. And then in hemolysis, that has to do with the breakdown of red blood cells. So if a patient is experiencing excessive breakdown of red blood cells, they are losing so much blood, they could suffer from folate deficiency. Then another cause of folate is medications. There are so many medications that can contribute to folate deficiency. One of them is phenytoin, which is an anticonvulsant. We have methotrexate, it's an anti-neoplastic medication used for cancer. It's also an immunosuppressant. And then we have trimethoprim sulfamethoxazole. This is an antibiotic. It can inhibit folate absorption. Now let's look at the signs and symptoms of folate deficiency. Just like with every other anemia, they will experience the usual signs and symptoms of anemia, which I've mentioned before, like all those pallor, fatigue, dizziness, tachycardia, and all that. But in addition, The patient will experience things like stomatitis, which is inflammation of the mouth, then cheilosis or angular cheilitis, where there's presence of cracks around the mouth. And then the patient will experience what we call burning mouth syndrome. So as the name goes, burning. So this is a very painful ulceration around the mouth and around the tongue. And then dysphagia, diarrhea, flatulence, mood changes, even decreased concentration or decreased memory or retention. So these are things that can happen. These are some signs and symptoms you may see in a patient with folate deficiency. Now, for the complication of folate deficiency, I want you to know this. One of them, the big one, is neural tooth defect. So when a woman, I've mentioned it earlier, a woman is deficient in folate and she conceives, the baby could experience this neural tooth defect, where there's a proper closure of the neural tubes, things like spinal bifida. And then we have anencephaly. This is a serious one where a baby is born with some of the brain and the skull absent. It can happen as a complication of folate deficiency. Then cardiovascular complication, and that's due to the presence of increased homocysteine. This homocysteine is a byproduct of amino acid. Usually the body doesn't need it again. When a patient is experiencing folate deficiency, this homocysteine level is increased and it's not supposed to be needed by the body at that point. When it accumulates, it can put a patient at risk of atherosclerosis, thrombosis, even stroke. So all those cardiovascular complications can arise because of folate deficiency. Now, for diagnosis, of course, when there's a decrease in red blood cells circulating, so there will be decrease in hemoglobin, decrease in hematocrit concentration, and there will be increased mean corpuscular volume. It will be greater than 100 femtoliters. And that's because of the macrocytic nature of folate deficiency, just like in vitamin B12 deficiency, that's pernicious anemia. So the red blood cells are abnormally large, they are larger than normal, and they're also megaloblastic. And then increased homocysteine, like I mentioned, this homocysteine is a byproduct of amino acid. But when the patient has folate deficiency, this will be elevated. But the MNA, which is methylmalonic acid, will be normal. So this is what differentiates it from vitamin B12 deficiency. In vitamin B12 deficiency, the homocysteine and the MNA will be increased. But for folate deficiency, the MNA will be normal, while the homocysteine will be increased. And finally, they could do a test to check the serum folate levels. For the management nursing intervention, first of all, we know that folate is gotten entirely from food. So if the patient is suffering from deficiency of this, in as much as we're going to encourage the patient to take enough of this from our diet, they can put the patient on oral folate. And then they can combine it with vitamin B12 deficiency. Remember, vitamin B12 deficiency and folate are both megaloblastic anemia. So at times their symptoms overlap. So just to be sure, they treat them, when they are treating them on folate deficiency, they also put them on vitamin B12 supplement. Also, food rich in folate, I've mentioned before, is so high in plant sources, like all those dark green leafy vegetables, legumes, spinach, kale, broccoli, asparagus, in nut, in seed, in fortified cereals. It's also present in things like beef and chicken liver, especially liver. In eggs, you can also get folate. You get folate also from oranges, from citrus fruits, very important. Now, teaching. So, as nurses, we need to teach our patients about signs and symptoms of folate deficiency. Now, apart from teaching them those signs and symptoms, also you need to teach women of childbearing age that are expecting to conceive, they want to have a baby, teach them to start taking folate. If possible, take food that are so high and rich in folate. And at the same time, once they start planning to conceive, they start trying to conceive, they can start taking folic acid. They can take at least 400 micrograms per day. And when they are pregnant, they should ensure that they do not lack folate in their diet. And at the same time, they should ensure they are taking their folate supplement. At times, they may prescribe more than 400 micrograms per day, but they should ensure that they are taking this medication. So you also teach them all those sources of food. Ensure that they know food that are high in folate. Simple as oranges. They get a lot of folate from this, and all those green leafy vegetables. Now let's review some NCLEX-style questions that will test your knowledge on folate deficiency anemia. Question 1. A pregnant woman at 8 weeks gestation asked why she was prescribed folic acid supplement. Which response by the nurse is most accurate? A. It helps prevent spinal bifida and other neural tooth defects in the baby. B. It prevents iron deficiency anemia during pregnancy. C. It decreases the risk of gestational diabetes. D. It reduces morning sickness in the first trimester. The best answer is A. It helps prevent spinal bifida and other neural tooth defects in the baby. Question 2. A note reviews lab result for a client suspected of folate deficiency anemia. Which findings will support this diagnosis? A. Low folate, low homocysteine, high methylmalonic acid. B. Low folate, high homocysteine, normal methylmalonic acid. C. Low folate, high homocysteine, high methylmalonic acid. And D. Low folate, normal homocysteine, normal methylmalonic acid. The best answer will be B. Low folate, high homocysteine, and normal methylmalonic acid. This helps differentiate it from vitamin B12 deficiency, where both the methylmalonic acid and the homocysteine will be high. Question 3. A client with chronic alcoholism is admitted with anemia. Did not suspect folate deficiency because alcoholism often causes A. Increased folate excretion in urine, B. Impaired folate absorption and metabolism, C. Increased folate storage in the liver, D. Enhanced folate synthesis in the intestine. The best answer is B. Impaired folate absorption and metabolism. Question 4. A nurse is reviewing the medication list of a client with a history of seizures. Which medication may contribute to folate deficiency? A. Phenytoin, B. Metoprolol, C. Furosemide, D. Digoxin. The best answer is A. Phenytoin. The last question. This is a select order apply question. The nurse is teaching a client about medication that can interfere with folate metabolism and lead to folate deficiency anemia. Which of the following medications are known to cause folate deficiency? Select order apply. A. Methotrexate, B. Phenytoin, C. Sulfonamide, D. Oral contraceptives, E. Atorvastatin. The best answer is A, B, C, D. That's methotrexate, phenytoin, sulfonamide, and oral contraceptives. So that wraps up today's topic on folate deficiency anemia. If you find this video helpful, please like, share, leave your comment, and subscribe for more educational videos. Thanks for watching.